Okay, we have one last question, and this is from the audience. It says, thank you for coming to speak today. I am a representative of Washtenaw Youth Initiative, an organization devoted to decreasing gun violence and increasing access to mental health resources. In the wake of low counselor-to-student ratios, children having heightened access to guns, and Congress cutting funding to education and mental health, how do you plan to support the youth of Ann Arbor in the pursuit of safe education?
Put simply, for generations, we've failed to address our gun problem. I'm just really so proud of the young people who are taking this issue on and insisting that we do something about gun violence in schools. We should be ashamed for our failure to have addressed it, but I support, especially these high school kids. They're just so brave to step up and demand that something be done. I think as a council, we have shown our support for the Ann Arbor Public Schools' desire to keep guns out of the classroom. I would continue to do that. It's important that we look for reasonable ways to address the access to guns by people who shouldn't have them. With regard to mental health, recently the county passed a mental health millage. In Ann Arbor, we'll collect about $5 million, but because we have our own police department, $2 million of that's collected for mental health and public safety will be returned to the city, and we're going to use it on a variety of issues that are unrelated to mental health. I oppose that misuse of the mental health and public safety money because we should be taking care of the problems that we have in this community with those funds. It would be nice to be able to address all of the wonderful things we want to do with those monies, but those monies are being collected under the guise of mental health and public safety, and this is exactly what this question is about. So I would support accepting those funds from the county millage and using them to address mental health problems, to address our opioid problems, which I really consider to be mental health problems, to address public safety problems such as the human trafficking and prostitution problem that runs rampant but silent in this community, instead of misusing those monies.